Hi, everyone. I'm Rustom Lawyer, CEO at Augnito, and welcome to the fifth episode of RadVoice, where we discuss relevant topics from the radiology community. We are now 4 months into the COVID crisis, and testing is clearly an integral part of controlling and managing this pandemic. And today we have with us Rahil Shah, Director of NM Medical, who is also a good friend, to discuss his insights on COVID-19 testing in India. So welcome, Rahil, and thanks for being on Rad Voice.
My pleasure.
Yeah. So Rahil, you guys are one of the premier diagnostic center chains in India, and you've recently started COVID-19 testing. What was the process like to set this up and get permissions for this in such a sort of short period of time?
Rustom, we were caught in an interesting and tricky situation when COVID first broke out.
Mm-hmm.
And the Maharashtra government imposed a lockdown and the country imposed a lockdown. In the sense that in our laboratory in South Mumbai, we had the entire infrastructure ready to perform COVID tests, but it was set up relatively recently, a few months before COVID broke out. And typically in a new setup in the lab, we would wait for about 6 months before applying for accreditation with the relevant bodies so that we have enough volume of data built up to go through the accreditation process. In this case, since it had been only a few months since we had set up the infrastructure, we weren't accredited by NABL for that particular section of the lab. And ICMR released a regulation stating that only labs approved by NABL for RNA testing, which is what we're doing when we look at COVID. Only those labs could apply for ICMR permission to begin COVID testing. So although our principal laboratory had NABL accreditation, the RNA testing section didn't. And for the first 30 to 45 days, we had to wait on the sidelines. It was very frustrating because we knew we had everything in place, the equipment, the people, the expertise, and a patient base that was very keen to get their test done with us.
Yeah.
But we couldn't begin because we would need accreditation from NABL and they were not functioning during the lockdown.
Yeah.
Then finally, by mid-May, NABL agreed after a lot of requests with them by us and a few other labs caught in a similar situation. They agreed to do online audits. So we put together the relevant process to apply online. And we went through an 8-hour audit beginning at 4 o'clock in the evening and ending at 2 o'clock in the night, close to 2 o'clock at night, which we passed, and we got an NABL certificate for the RNA section of our lab. Immediately, we put that to ICMR, and I was very impressed with the speed of response of ICMR right through this process. Any queries we raised to them, they were very responsive. They got back to us in a few hours. Even once we sent them the NABL approval, the very next day, they sent us the approval to begin COVID testing. So I think at a central level, the proactiveness was great to see. For us, it was a challenge initially being on the sidelines, then going through an online audit, which is very different from an in-person audit. So getting the team attuned to go through that. But in the end, it was worth it. We got the permission. We were able to begin. And it took us a few days to understand the ICMR process for testing and uploading results to both ICMR as well as the local ward offices in Mumbai. Once we understood that, we could ramp up our testing pretty quickly. And we started sometime in early June. And now, we perform a few hundred tests every day across the city of Mumbai.
That's great. So what type of tests are these? Can you tell us a little bit more about it?
Sure.
It's also the sort of accuracy that you'd get, the price and sort of accessibility and things like that.
Sure. So the tests that I'm referring to now are swab tests, which we analyze using a method called PCR. So it's a molecular test and RNA analysis to identify the strain of the virus and whether it's positive or negative based on how the virus is expressing itself in that sample. Now, for up until about mid-June, this was the only approved testing method for COVID-19 in India. Mid-June onwards, ICMR has also approved 2 additional forms of testing. One is an antibody test, which is from a blood sample, and another is an antigen test, which is from a nasal swab. Okay, so the PCR test is from a nasal and an oral swab. The antigen test is from a nasal swab only, and the antibody test is from a blood sample. no different to drawing a blood sample for any other vitamin test or thyroid test or so on. Right? Now, PCR is the gold standard. It's the globally established as a gold standard for assessment of active infection in an individual. So, if an individual is acutely symptomatic with all the COVID-19 type like symptoms, one or more, two or more, I believe is the guideline, or is high risk in the sense that they've had direct contact with a lab confirmed COVID case. Those patients should be directly tested by PCR only. And if the PCR result is positive, based on how symptomatic the patient is, the BMC ward gets involved as well. And they guide the patient on how to manage the condition, whether to isolate at home, whether to isolate in a dedicated quarantine facility, or whether to get hospitalized. Okay, so it's a combined decision made by the clinician of the patient as well as the local BMC ward. The second test, antigen test, is more of a spot test. So it's for acute clinical settings. So in a hospital, if a patient needs to be operated urgently, or a woman is going into labor, unexpected labor, or in daycare setups like dentistry or endoscopy, where it's really not practical to do a PCR test. And so I should mention with a PCR test, the turnaround time typically is about 24 hours, right? From the time of collecting the sample to issuing a report, it would be anywhere between 18 to 24 hours. So that's a long time to wait for an emergency result or for a daycare procedure like an endoscopy or a dental setup, where routinely as patients walk in today's COVID environment, we would want to know whether the patient is safe for the dentist or the gastroenterologist to perform the procedure on that patient. So for those settings, the antigen test becomes a good test to look at. That test is also useful in hotspots, containment zones, where we want to know quickly for a large mass of people whether the patients are positive or negative. Now, the guidelines for the antigen test, there are only a few vendors approved whose kits can be procured for antigen. The guidelines for this test is once you collect the nasal swab, if the result is positive, that's the end of the story. There's no reason then to do any additional tests to confirm. It's treated like any other positive patient on RT-PCR. If the result is negative and the patient is asymptomatic, like let's say we've done for a daycare procedure and patient is asymptomatic, just to make sure that the patient is safe to treat, we've gone ahead and done the test, then that result can be accepted, no further validation needed. But if the patient is symptomatic and the result is negative, that still needs to be then reconfirmed with an RT-PCR test. Okay. So those are the two swab tests that are available and being offered now in the market under specific use conditions. The RT-PCR guidelines have been relaxed considerably. So one really has to make an informed decision on whether to choose the PCR test or the antigen test based on the appropriate clinical setting. Now coming to the antibody test, this really to me is the most interesting of the three because it allows us to screen at a mass level to understand serosurveillance, right? And to understand extent of COVID prevalence in our society. So whether we do it in residential societies, whether we do it in offices, whether we do it in containment zones, it allows us to understand a couple of things. For asymptomatic patients who per se don't present any risk of being COVID positive, if the antibody result is positive, then we know that they've been exposed to COVID at some time in the last 2 or 3 months, but they're not necessarily active carriers today. If anything, they've developed protective antibodies against the virus that will insulate them from getting reinfected anytime soon. Because in India, we've seen reinfection rates to be very low compared to the rest of the world. If they're antibody negative and are not exhibiting any symptoms, in all probability, they've not been exposed to COVID, right? But we still recommend doing a repeat test after a week or so, because if they've been exposed very recently in the last 2 or 3 days, the antibodies would not have developed yet. So you do a dual antibody test split over a course of a week. Both results are negative. You know that person is safe to be taken back into the society or back into the office. The nice part is there's no BMC involvement here. We do report the results, but that's from a serosurveillance perspective. So the government can know what percentage of people in India have been infected with COVID. But BMC does not get involved in the clinical management of the patient, right? So it's a great test to do as a screening tool. So now, today we're lucky that the Indian government allows all these three tests to be offered to the public. At NM, we offer all three. And our recommendation, particularly for asymptomatic people who just want to do the test to know whether they're safe, is to do a combination of the antibody and the antigen test, and the PCR test to be performed only for symptomatic or high risk patients. That's how we are stratifying our patient populations today.
Okay. Oh, that's great. It's really interesting. Get this insight from you. A little bit now about your business and from the sort of HR side and how you've been managing through this time. We've been working with you for quite some time now, and with your radiologists as well, with our Augnito solution. So, could you share with us, how it sort of helped you sort of adapting to the new normal
Yeah.
during this time?
Yeah, Rustom, I'll tell you, Augnito has been a lifesaver in this time because it's so difficult. You know, what happens typically with our staff nurses, the computer operators who used to transcribe the reports before Augnito came into the picture,
Sure.
and lab technicians. These are three categories of employees where predominantly we have female employees, right?
Yeah.
And at the moment, we're seeing that with female employees, they're finding it very hard to leave their homes. Either someone at home's been infected and they need to be around to take care, or they live in joint families where the extended family is not comfortable with them stepping out and potentially coming back and infecting other people in the family. So it's a maybe a little bit of a gender bias in India and the way Indian families work, where males are allowed in this time to go out and work, but females are discouraged from doing so. Now,
Yeah.
in this environment, uh, most of my centers today don't have a computer operator coming in and transcribing reports. So they're
Yeah.
all using Augnito.
Yeah.
And these are the technology tools that we need to bring in a larger way. It's one of the reasons why we've also adopted so much automation in our lab, more than what we need probably for a lab of our size. But
Yeah.
we invested in total lab automation. We have middleware um, in our lab, which essentially allows auto validation of results, auto screening of QC, all of that because we want to reduce our dependency on manpower and on manually driven processes.
Yeah, I remember
And
actually coming and seeing your lab. I mean, it was really cutting edge.
yeah,
Remember coming and seeing it. Yeah.
so we love technology and we want to employ it, and COVID has been the best illustration of how technology can help overcome a very challenging time period.
Sure. That's really great. And no, it's been a great experience working with you guys as well. So, just one last question. It's been a couple of months since you've started testing. Are there any sort of trends that you're seeing that could be sort of useful for our viewers to know about from this?
Yeah. So I think right off the bat, the one thing that has to change, and we're seeing this, and it right from day one, and it continues till today, is this whole panic, hysteria, and fear psychosis around COVID.
Hmm.
Somehow, getting a COVID test done or being asked to do a COVID test gets people to behave in ways that you would never imagine them to behave. So
Yeah.
right from follow up for scheduling an appointment to following up for their result, and then God forbid if they're positive, dealing with that result, it's just been a very hysterical process. And we're talking about educated patients,
Yeah.
patients who from South Bombay who know how to deal with any disease. Right? It's not the first time they've been infected with an illness. So this whole stigma and fear psychosis around COVID needs to change. I think what we've all realized is it's not going away anytime soon. What's encouraging, what we're seeing in the last few weeks in particular, is there are a lot of asymptomatic positives, right? So uh, patients are being detected as positive, but they're not symptomatic. They're not infecting many people around them. BMC is allowing them to isolate at home. If there is enough space in the home for them to isolate. So this whole panic and stigma needs to go. We have to
Yeah.
learn to live with the reality of COVID. That would be my sort of two bits to all the viewers, that let it not get to you and affect you to a point where you then can't focus on your everything else that's there in your life. The other thing that we are seeing is a very interesting correlation between radiology and laboratory. And I've been a big proponent of pushing, uh, combined analysis of lab and radiology in a bunch of areas, gynecology, oncology. We're seeing that now with virology, where for a whole bunch of COVID positive patients, we perform chest CT scans and chest X-rays. And there's a great correlation between findings on the chest CT scans and what we see on PCR. At the same time, we also find cases where the PCR misses finding. You get a false negative, and then the radiology chest X-ray shows very typical characteristics of COVID.
Yeah.
So I think that with technology and AI now coming into play in a larger way, we really need to find a way to marry pathology and radiology better to give a more meaningful analysis across a variety of medical disciplines, including COVID. And I know some companies are working in that direction. So we would be most interested to engage with anyone, who can make that happen for us, because we offer both. Across,
That's really interesting.
methods.
Yeah, we should talk about that sometime. So
So that's where we are. It's been an interesting journey. I think it's going to continue for a while.
Yeah.
So I'll keep you informed on how things are going.
Yeah, no, so thank you so much. I mean, it's really been interesting, Rahil. And thanks so much for giving us this time, and especially for providing such a great service with the testing and everything during this critical time. So thank you.
Thank you, Rustom.
Yeah. So thanks everyone for watching this. We're very excited to share that Augnito is actually launching a new voice recognition solution for Mac users. And if you're interested to try, please leave your comments below. Thank you, everyone.